A very good morning to you. I'm Howard Feldman. This is the Sunday Synthesis Podcast with me, Howard Feldman, and Dr. Anton Meyberg. It is the 11th of July, 2021. Gauteng in the midst of the third wave. It's looking horrible out there. More and more people becoming ill. The hospitals, from everything we understand, not seeing a turnaround. But yet somewhere, and some people saying that in fact we have peaked. Dr. Anton Meyberg, good morning. Have we peaked?
Good morning. So we'll get to that shortly. There are currently 187 million cases worldwide with 4 million deaths and 171 million cases resolved. The United States has 34.7 million cases with 622,000 deaths. India, 30 million cases with 408,000 deaths. And Brazil definitely creeping up there with 19 million cases and over 500,000 deaths. South Africa has 2,179,297 cases with 64,138 deaths and 21,610 new cases in the last 24 hours, a case positivity rate of about 28%. There are currently 8,804 cases in Gauteng hospitals with 1,429 ventilated, 1,429 in ICU and 869 ventilated. Now, according to the academics, and according to people that we actually follow very closely, such as Ridwan Suleiman, the rolling average for the last 7 days of cases in Gauteng is definitely on a downward trend. But, and I say the big but, that hasn't transferred over to the hospitals yet because the hospitals are still jam-packed. We still don't have ventilators. We still don't have ICU or high care beds, and our wards are still packed. So although we may be seeing a slight decrease and a turnaround in the numbers in Gauteng, that is not the case for the other provinces in South Africa at the moment. Other provinces are now starting to go on an upward trend. And I definitely think that the lockdown has somewhat helped with regards to the trend in Gauteng.
What is the traditional lag between positive cases and the hospital and death? Because I would imagine that does take a while to translate or
10 to 14 days generally. And that's why I say we're probably about there's a 2-week lag in the hospital before we're going to start seeing cases start going down, please God.
Right. But obviously it means we need to continue as we are.
You have to continue as you are, keep on with the non-pharmaceutical interventions, with the masking, with the social distancing, with no social events, with not going to any communal events, with not going to any religious events, keep on sanitizing and just keep on doing everything that we're supposed to be doing.
What's your thoughts? Because we actually are at the end of the 2-week lockdown. It ends today. What we don't know what's going to happen at this stage of recording when we're recording the podcast, but what would you recommend?
So I would recommend not to change. I think that it's definitely helping. I mean, albeit it's not the easiest thing to have a level 4 lockdown for many reasons, but we need it because we need to curb the upward trend of the cases, especially in other provinces now. And I do think the curbing of the travel between the provinces has helped a lot, even though I'm sure some people are managing to get in between somehow. But the majority of people, for business, the majority of people who are actually following the rules are helping curb the trends and actually helping bring down the curve.
A lot of our questions today relate to the efficacy of the vaccines. In fact, I would say a significant portion of the questions are around it. People are hearing about people who have been ill with both the Johnson & Johnson and the Pfizer's, people who have died. But I don't know what is anecdotal. I don't know what is absolute. Can you give us obviously the academic approach to what we're being told around the vaccines, as well as your experience with both the Pfizer and the Johnson & Johnson?
Okay, so categorically, these two vaccines work. There's no doubt about it, okay? There will never be a vaccine that is 100% efficacious and will stop some people from dying, some people from being in hospital, but the majority of the variants are responsive to the Pfizer and to the Johnson & Johnson. And so much so that the Johnson & Johnson is actually appearing to be more efficacious against the Delta variant than it was against the Beta variant. That's the Indian variant versus the South African variant. And the Delta variant is what's literally consuming our country at the moment. As well as the fact that the Pfizer is as efficacious. What the studies have shown in the last week is that with symptomatic infection, there's a lower rate of uptake from the actual vaccines. In other words, you probably get about a 60 to 70% efficacy with the vaccines, but with regards to severe critical disease and hospitalization, there's about 100%. You're always going to get breakthrough infections. There's no doubt about it. And I can say for the majority of cases that I've seen with the breakthrough cases, they've been mild to moderate. A few have been in hospital, but the majority, I'm talking about 99% of the cases, have really been okay and done well and managed to go home. As I say, nothing's foolproof. You can't prevent everything from happening. Other people have got other comorbidities and other issues and other problems develop. You can get hospital-acquired infections, you can get pulmonary emboli, you can get all other things that can develop as a result of these things, and you can't prevent these things from happening. And that's why we can say that no vaccine is 100% efficacious, but they're effective and they work and they do save lives.
So would you say because and I don't know what's valid or not, but people have sent me cases of people that might have died after one of the vaccines. In the cases that you've seen, there were other extraordinary factors around that, and it isn't necessarily a simple thing of having the vaccine, getting COVID, and then death.
Yeah, I have to agree with that. As I said, there's no vaccine that's 100% proof. But the majority, and I'd go up to say 95 to 97% of people will not die if they've had the vaccine. You will always get a small amount of people that could die and will die, and you can't prevent that. But generally, those are the people with other comorbidities, whether they've got high blood pressure, increased body mass index, emphysema, diabetes, all of those type of things play an added role in the whole picture. And what we do know, and it's very important, we know that if you've had your first Pfizer vaccine, you're already decreasing your incidence of infection by about 33 to 40%. But you have to have your second vaccination. It's so important. Okay? It's very, very important. And as the studies have shown, and as what's come out from Johnson & Johnson, the Johnson & Johnson itself is supposedly completely efficacious against the Delta variant. But the jury's still out whether or not you're going to need a booster from the Johnson & Johnson. But so far from what we're seeing, is a very good response to people who have had the Johnson & Johnson with regards to not getting severe or moderate disease or landing up in hospital. As I said, there are always going to be one or two people that do have these breakthrough infections that you can't control, and that's not in our hands.
Right. A lot of questions as well about people, and I know we covered it, but it is worth going through again, because what we find is that people hear the things that are relevant to them, but then a week later something else might be. If somebody has had the first shot of Pfizer and then they've contracted COVID, do they need the second Pfizer? And number two, how long should they wait before they have that second shot?
Okay, so let's sort of juggle it up a bit and say as follows. If you had COVID and then you need to get your vaccinations, you get one Pfizer afterwards, because that Pfizer is a booster because you've got antibodies from the first episode of COVID. Whether or not you had it in July last year, whether you had it in January this year, you still only need one. Now, Pfizer have come out with a statement saying
so wait, I want to just stop you there. So that's important because that's also part of the questions. It doesn't matter which variant you had.
Right. Okay. You only need one booster. And this is coming from Prof. Shabir Mahdi, who's giving us the advice regarding all of this. So, I mean, it comes with high authority and on good sort of research and good understanding and knowledge of what's going on. So COVID, one vaccine. If you've had one vaccine and you get COVID a month later, you don't need the booster. Okay. But let's say you haven't had any vaccines, you haven't had COVID, and you go for your first vaccine, and within a week of having that vaccine, you get COVID, then you should have your second vaccine at a later stage, depending how sick you are from that. We've always got to decide if you need it a month later or 3 months later, because it's thought to be within the realm of a week of that COVID infection. We know that the effectivity of the vaccine will not be as efficacious or as effective as it would have been had you not have had COVID at the same time. So that's very important. Okay. But now going back to Pfizer,
let me just clarify. In other words, if you have the vaccine and immediately get COVID, it actually dampens
the effect.
Right. Okay. So that's important.
Yeah, and that's why you should have your second then vaccination at a later stage. Stop coughing, Howard.
I'm sorry. People panic. I'm fine. I'm really fine.
Yeah. Now, what Pfizer have come out with this week is that they believe people should have a third shot, which is a booster shot. Now, we've got to take this into context as well. First of all, the CDC and the FDA have come out completely against this, and they came out very quickly. As soon as Pfizer put that statement out, they said it's unnecessary and it's not what they are advising people. This is for people, for instance, who live in Israel, who were vaccinated 6 months ago. They're saying that the antibodies and your protection wane after 6 months, and that could be true, but it needs to be verified. We've always said that we believe that people are going to need further antibody or further vaccination down the line and are going to need the boosters down the line. And it may well be that 6 months is the preferred time afterwards, but I think that needs to be researched and brought about and seen by all the big authorities to decide if it's necessary. But I mean, literally, if you have had your vaccine 6 months ago, there's a higher chance of your antibodies waning and your T cells and your C cells not working, B cells not working as well as they should be working. So there might be a reason for a third booster, but it's not been proven as the way to go just yet.
Okay. And then just going back one more time, if you've had the Johnson & Johnson, it does seem efficacious, but we don't yet know if it's going to be required or advisable to get a booster.
To have a booster of Pfizer. Yeah, it's not the recommended thing. If you do have one, let's say you have as a study showed overseas, someone who had the AstraZeneca and then had a Pfizer after showed a much higher efficacy and much higher immune response from having that. So that could be a realistic expectation to look out for, to say that you could get a better immune response from having a booster with a Pfizer if you had the Johnson. But as I've always said, we need to wait for people who haven't been vaccinated before we greedily take vaccines from people who actually haven't.
Right, absolutely. Okay, and now taking a look at some of the questions around quarantine, because some people that I've spoken to, and it is quite strange that we still are a bit confused as to when a household should be in isolation or quarantine. Can you just
listen?
I've got
to say something very honestly. This virus makes fools of all of us. Because as doctors, as lay people, as Google searchers, none of us are any the wiser after knowing all of the facts, and we all learn new facts every single day, and things change. So
you're not being judgy.
It does happen.
Okay,
no,
so you're not being...
Today is my non-judgy day.
Why is that?
Pure exhaustion and fatigue.
Okay, fine. We like you this way. We do. We don't really. No, we definitely don't. We look forward to the day when your personality comes back. So let's just go through, because I do think to some extent, I mean, you list all the comorbidities of COVID. I think that stupidity is one of the significant ones. We haven't really ever listed stupidity as a comorbidity, but we probably should. That said, can we go through again when people should be in isolation/quarantine and not?
If you come in as a positive contact with somebody who's got COVID, when you're not wearing a mask, or you're in an indoor facility where the windows aren't open and you're more with them for more than a few minutes or more than a few seconds, you should be in isolation. You should be quarantined. And we're talking about for 10 days at least. The advisory is for 10 days. Some people can take it up to 14 days, but 10 days is the baseline of quarantine isolation.
Are we seeing the Delta variant behaving differently, in the sense that people are getting sicker later on in that period, in that isolation?
We definitely are. You know, in the first and second wave, people were sort of sick for 5 or 6 days, and then by the 10th, 11th day, they were much better. But what we're seeing here, and especially in the hospitalized patients, is that people come in unwell and they progress rather rapidly until about the 10th, 11th day, and then they just have this progressive cytokine storm, this inflammatory response where they just deteriorate dramatically from a respiratory point of view, from a cardiac point of view. And it's because it's a much more transmissible variant, and because it's definitely a much more infectious variant, and it definitely makes people sicker. And it's definitely got longer sequelae consequences from the actual disease. So, albeit people are going to say, but how can you still have COVID if it's after 10 days? This is a result of the COVID. This is a devastation that COVID wreaks on your body and what it does to you.
When are you infectious until? Because that's another question we got. We've got plenty of those.
The whole point of the 10-day period is to give you the 10 days that you can't be infectious after the 10 days. You know, it generally takes about 7 days for the virus to stop replicating. But we can't go about, well, if you had a sniffle the one day, but then you didn't have a sniffle the next day, and then you had a headache. And it's a lot of the time, it's a lot easier to say, when you've tested, if you're positive from the time of the test, you take your 10-day period from then. Obviously, if you tested on Sunday and you had a severe headache and you were coughing, you had a fever, and you get your result back on Monday, you can start your counting from the Sunday. But if you test on, let's say, Wednesday, and you said, well, I might have had a bit of a sniffle on Saturday or Sunday, it doesn't really fit in, so rather take it from the day of the testing.
Right. So if you are absolutely clear and honest with yourself, and you know when your symptoms started that left you little doubt that you had COVID, then you take it from that day. There. If you weren't, from 10 days from there. And I think a very important thing, and people are still misunderstanding this. Once you've had the COVID and you've had your 10 days of quarantine or isolation, you do not have to retest. You do not have to retest. You don't have to go and prove to the work that it's negative, because a lot of the time you will still have virus lag in the body and you will still test positive for up to 4 to 6 weeks. Right. And if, for example, you've gone through your 10 days, you've had your test, you go through your 10 days, but you're still coughing at day number 10, are you able to go out? Are you comfortable that people aren't infectious at that point?
So I think you must speak to your health practitioner, speak to your GP or speak to your specialist. And if you've had your test and you're positive, let's say you're isolated because you are positive, and after 10 days you're still coughing, but you've got no other symptoms, you're going to cough for a while. People do cough for a longer period of time. We do see long COVID. We call it the long sort of effects of the COVID itself, the sequelae of having a long period of COVID. But it doesn't mean you've got to stay in isolation. But when you go out, you still need to wear your mask. You still need to make sure you social distance, so that if you are by some weird reason contagious, you don't contaminate other people with infection.
If I'm in a house with somebody, or if somebody's in a house with somebody, they get COVID, and then a few days later, their partner, their wife, the child, whatever it is, gets COVID.
Yes, that's a very contentious question.
Oh, I like it then.
Yeah,
because it does get confusing.
There's a lot of disagreement between medical practitioners and specialists and GPs. And as I always say, go with who you follow. But my feeling is as follows.
Yeah, what's yours?
If you're let's say we're in house and person A gets infection on Monday, okay, right. And then the other person's isolating in the house, and then they haven't tested because they're not sick. But on Thursday, they become symptomatic and they test, and then by Friday, they get their results. There's a 4-day lag between that. Obviously, that person then starts their actual isolation from the Friday. Right. But if you live in the same house, you're sharing the same utensils, you're sharing bathrooms and this and that, my personal feeling is the person who was starting, person A, should quarantine the whole length of time with that person, because you're sharing all the things. Obviously, we know that person A has got antibodies or will be developing antibodies. We do know that 30% of people don't develop antibodies. But the general norm is people will develop, and they shouldn't be an issue to themselves. But we still don't know per se if they can transfer the virus to other people. And that's why, from a safety point of view, it's far safer to keep the people at home than let them go out at the moment, especially in this stage or this level 4 lockdown, especially in this wave, this third wave of the pandemic, where we just got to protect people and try and make sure that no one gets sick.
In other words, just to summarize that, what you're saying is that person A should stay in quarantine with the family until the last person is
and that's my personal opinion. As I say, I'll get a lot of flack for that because a lot of people won't agree with me.
Doesn't matter. But we've dealt with ivermectin. We laugh in the face of danger.
The point of the matter is you've got to understand why you are doing it and how important it is to other people that you actually stay away from people so that you can't transfer the virus to other people.
Right. Okay. The rapid COVID test, lots of questions around that. Are they accurate? What happens if you get a positive or a negative there?
So the way we look at the rapid COVID test, first of all, it's got to be ratified by SAHPRA, it's got to be SABS approved, all of those sort of criteria. If your rapid COVID test is positive, then your test is positive. Doesn't matter. I mean, you obviously do a confirmatory PCR test, which confirms it, but it's not always necessary. If the rapid is positive, it's positive. But if the rapid is negative, it does not mean that your PCR will be negative. We've had a lot of cases that we admit with a negative result, but they're still symptomatic, they're still coughing, they still got fever, and a day or two later, the pickup rate on the PCR is much higher and the person is positive. So you've got to take it in clinical view with the actual picture that you're seeing.
All right.
If the person is well, let's say, let me just clarify that. If the person's well and they've got no symptoms and they've got no contacts and the RAP is negative, then you can say, I'm assuming the RAP is negative, and that's fine. But if there's any signs that the person's sick or feeling unwell, then you should retest with a PCR.
Right. Okay. Talking about that, I'm just going to read you one question that is, I think, almost representative of what so many people are grappling with every day. My domestic worker tested positive on Tuesday. She was perfect on Monday. At work, she felt nauseous. Monday night, she woke up with a tight chest and did a rapid COVID test, which was positive. We are now all in quarantine. Okay, good so far. On Monday, I had the second vaccine. It's day 6 and I am feeling a bit stuffy, but other than that, not many other symptoms. Nor is anyone else. Do we have to test, or is it not necessary?
So there's a few issues to that. And what we've seen throughout this whole process of the vaccination is that people who stand in these long lines at vaccination and people who are mass gathering, there's a high propensity for them to get COVID or to get SARS-CoV-2. So there's a risk. We know that unless you're wearing your mask properly and social distancing properly, and it's very difficult to do this in that type of environment of vaccination queue. But if you've been isolating and you've just got a stuffy nose, you've got no fever, no cough, it could just be a plain old viral infection, and just let it be. If your symptoms get worse, then test. But if it's just a plain stuffy nose and it's only for one night and it's not an issue, it's not lingering, doesn't carry on, then don't test. But if it does linger and it does carry on for more than a day, then you should test.
Okay, because there are lots of questions about that. It does get very, very confusing. And I just want to as well, if somebody tests positive and you were with them, what is our period before they showed symptoms that we can consider ourselves safe?
It's about 48 to 72 hours. So if you were with somebody on Monday and then they tested positive on Friday, you don't really have to worry. But if they tested positive on Wednesday, then you need to go into isolation.
All right. We don't have a lot of time for some of the specific questions, but I have covered a lot of them. I just want to go through one or two of them. If one is going for a walk alone, or just with our family, there's no one else in close proximity, no one else in the road, is it still important to wear a mask?
So the law of the land is that you have to wear a mask. It's mandatory to wear a mask when you leave your house, or if you've got people inside the house that aren't family members. So the answer to that is simple: you have to wear a mask.
Is it safe for vaccinated people, especially family members who would like to be spending time together, like older parents and older children? For example, my father, somebody is saying, if they've all been vaccinated, is it safe to spend some time together?
We've got to clarify what spending time together means. So if spending time means sitting in the garden where everyone's sort of socially distanced and you're wearing the mask for most of the time, if the people have got comorbidities, then that's safe. If you're going to be sitting in the same room without masks, it's not safe. Despite being vaccinated, it's not safe unless you have got to follow the non-pharmaceutical intervention still.
Somebody asking about the Moderna vaccine. How come we're not getting it? I don't know if you would. That's not really your field.
That you'll have to ask the government. That one I can't answer. I mean, at the moment, we've got the Johnson & Johnson and the Pfizer.
All right. And in terms of information you've seen around the Sinovac, still rather go with one of the other two?
The point of the matter is that if you look at the Sinovac and you look in Brazil, Peru, all of those areas where they've got different variants. They've got the Lambda variant, they've got the Delta Plus variant. And from that point of view, it seems to be okay. But we still don't know what the efficacy or how effective it is against the Delta variant. In Brazil, they haven't had a massive outbreak of Delta variant. They've had the Lambda and Delta Plus, and so we don't know. At this point in time, being true to myself, I wouldn't want to take the Sinovac myself. But we're waiting for more details from SAHPRA. Let us give us advice and say to us, it is highly effective against the Delta variant. It's highly effective against the Beta variant. Then there's no reason not to use it. But at this point in time, we don't. There's a paucity of knowledge about what to use with regards to Sinovac.
In terms of the other variant that you've spoken about, we haven't closed our borders at all. That's obviously how the Delta variant is so significant here in South Africa. Is that a concern as to how we are dealing with our borders?
It's a massive concern. Not only have we not closed our borders, but we're not isolating people when they're entering into the country either.
Yeah,
so it's kind of a free for all. In any other country in the world, when you go there, you have to isolate or quarantine for 14 days. Here, you can just come into the country and do what you want ad hoc.
Is there any reason we've thrown that out the window?
No idea.
Right.
I can't have a comment. It makes absolutely no sense.
Just give me a sense, because I didn't ask you how it's looking. I mean, I know you told us right at the beginning of the podcast how it's looking at the hospitals in terms of beds, ventilators, very, very difficult. How many admissions, how many deaths are you seeing on average a day there from COVID?
So the numbers are high. The numbers are extremely high. We're averaging about 20 to 25 admissions a day from COVID. I'd say of the 25, 24 and a half are COVID, and half is maybe a person under investigation. Essentially,
Right.
Everyone we're admitting at the moment is COVID. Very few are coming in as non-COVID admissions. The number of deaths are high in all the hospitals. People are succumbing to this disease. It is extremely transmissible, highly contagious, and highly virulent variant that is causing pandemonium across the country, pandemonium in Gauteng, pandemonium in the hospitals. And you're seeing a lot of fatigued, exhausted healthcare workers, nurses, physiotherapists, doctors. And I do believe there's going to be a high load of post-traumatic stress disorder in all these healthcare workers from what they're going through, because you don't get the opportunity to grieve for your patients, because as soon as one patient is lost, then you've got to move on to the next patient. And there's no ability, or there's no way to be there for your families, to help them get through this, or yourself to actually conceptualize what is happening and what you've been through.
Well, I just want to actually reveal a private conversation you and I had last night when we were talking about the number of deaths. And I said to you, does it get any easier that you're just signing one death certificate after another? And you answered, absolutely not. It's just not. It doesn't. And I think the answer to that is that I hope it never will.
Yeah, look, it's not easy, that, and it's much harder, unfortunately, during this period where we're just being absolutely, for lack of better words, decimated and destroyed. So please God, it will get better soon.
Please God, it will. Just hang in there. Is there any good news?
So I do think there is a bit of good news. I mean, especially in Gauteng, and the fact that we're seeing that the numbers are peaking and we may be going over the peak at the moment, that is some sort of good news, and we've got to hold on to that. And there's some sort of hope there, and there's some sort of promise. And we just got to hope that we can maintain this and get this over and done with, and get as many people vaccinated as possible, because that's the answer here. The only answer to getting through this is getting the country vaccinated as soon as possible. Not tomorrow, not the next day, but today. We need it done ASAP.
And just go out and get your vaccine if you possibly can. If you can register.
And that is the good news, yeah, because they're now registering 35-year-olds from the beginning of August.
Finally, I can register. Yeah.
Yeah, no, I'm very excited about that. You can register. It says 35-year-olds.
I mean, I just made it into that 35 category, but finally, it's going to happen. All right. That's unfortunately where we leave it. Please don't forget to send us your questions. I know we didn't answer a lot of the specifics. I did try and group them and make sure that we covered as many of the subjects that you needed us to cover. Subscribe below, send us your questions, and we'll see you next week. In the meantime, be safe, be kind, and God bless.